Hi, everyone. We have the Surgeon General of the United States, Dr. Vivek Murthy, with us, and we're so excited to chat with him about the COVID vaccine. The Surgeon General is often known as the nation's doctor, and a big part of his job is to give the public accurate and science-based information. No opinions here, just information based on medical facts and science and things that we currently know. So Surgeon General Murthy, thank you so much for taking the time to discuss this critically important topic with the Luz Collective audience.
Well, I'm so glad to be here and I'm happy to talk about vaccines on a day like this in particular, which happens to be a landmark day in the effort to battle COVID.
I want to go ahead and get started on this important conversation. Currently, all adults 16 and over are eligible for the COVID vaccine, but realistically speaking, when will there be enough vaccine doses for everyone to receive this vaccine?
Well, that's a great question, Luz. And the good news here is that the supply of vaccine has been steadily increasing month after month after month, this calendar year, such that by the end of May, we anticipate having more than enough vaccine, to meet the demand. And by the end of July, we anticipate having more than enough vaccines to vaccinate every adult in America. And so those are big steps forward. And, obviously we'll need to keep going beyond that. We need to vaccinate kids when a vaccine is proving to be safe and effective for them. So we're going to continue to procure more and more vaccine. But what we've also got to do in parallel is make sure that we are getting accurate information to people so they know what these vaccines are, they understand how they may help them, and they can make decisions for themselves and their families based on accurate information.
Agreed. I got my vaccine on Friday, so I'm super excited. I'm sharing it with everyone. I'm posting it all over social media because I think we are such important individuals to tell this narrative that, go get your shot. It's important.
I got to say, I'm like you as well. I got my vaccine, a few weeks ago. I had my family vaccinated too. Like as soon as my mother and father and my grandmother became eligible for the vaccine, like we had them vaccinated. My sister, who's a doctor, got vaccinated. My wife just got vaccinated. We're getting our whole family vaccinated because it turns out that the best way, the most effective way for us to turn this pandemic around, protect the people we love, and protect ourselves is to get vaccinated. You have to also consider the flip side, if you will, the alternative to not getting vaccinated.
Yeah.
And that's to potentially run the risk of getting the COVID infection. And we know, for example, that one of the variants that's spreading in the United States right now is a more contagious version of COVID than what we were dealing with last year. So that means that the risk of getting sick is significant. And we know from the last year that getting sick is no simple proposition. We've lost over 560,000 people in the United States to COVID. My family, we've lost 7 people between our family here and our extended family in India. But we also know that even in addition to death, which is a worse consequence, that many people have been hospitalized. Many people are dealing with long haul symptoms from COVID months after their infection. So the risk that you may worry about with short-term side effects, from the vaccine, like feeling fatigued or feeling, feverish or achy for a day or two, those really, for most people, pale in comparison to what it means to get COVID, which is a much, much greater risk to your health.
Exactly. And we have seen reports that say that the Latinx community is falling behind on receiving the COVID vaccine because of lack of access to registration, email, computers, language barriers. What is the federal government doing to help overcome these barriers? And what can we do on a personal level to get our family and friends to access the vaccine?
Well, this is such an important question because the Latinx community has been particularly hard hit by COVID. We know that infection rates and death rates have been disproportionately higher. And that means that we've actually got to do disproportionately more to make sure that we are taking steps to protect the community. That means we've got to make sure we're getting the vaccine in places where it's easy for people to access. That's part of the reason why actually the federal government has partnered with states and really invested in setting up community vaccination centers, especially in underserved parts of various communities across the country. It's why we've invested in mobile units to actually bring the vaccine to where people are instead of waiting for them to come to centers. It's why we've pushed a significant amount of vaccine directly to community health centers, which is a place where a lot of people get care. And it's also finally why we're working hard to get the vaccine into the offices of doctors so that they can give the vaccine directly to their patients. A lot of people say to us that they want to hear from their doctor. They want to talk to their doctor before they actually get the vaccine. So we know that, the more people can do that, the more they can get that vaccine directly from their doctor, the easier it's going to be. We got to do all of this together to make access easy. But finally, let me just remind all of us of this. If we want to have a successful vaccination effort in our country, if we want to turn COVID around, then it's not just about what the government is going to do, the federal government, state government, or local government. It's also about what we do to protect ourselves and protect the people we love. And that's why getting the information so you can make the right decision, getting vaccinated, but then turning around to ask your friends and your family what their plan is to get vaccinated is so important, because you never know when you're going to be the trusted voice that helps somebody make that decision or that motivates them to go and get protected. That's the role that we've all got to play here. This has got to be a people-powered movement to protect our country, protect our community. That's how we're going to defeat COVID.
Yes. And as a platform by Latinas and for Latinas, we often know that we are, the ones who carry this information, who are sharing it with our families, who are making sure our moms, our grandmas, our abuelitos, everybody in the family is getting their COVID vaccine. So it definitely is a message that we have to, push through our community and through our families. Like, have you gotten your vaccine? If you haven't, let me help you register. So want to echo everything that you're saying, because we are truly making the difference in making sure that our community closes that gap in getting the vaccine.
And if you just think for a moment about the community members that have passed away, I think about my uncle in Dallas, for example, who was struggling with Alzheimer's and was at home though, and the company of his wife and my cousin, he died before he could get the full protection of the vaccine. And I so wish that he had been alive in time to receive the vaccine. And you think about the families of the 560,000 people who've been lost. So many of them would do anything to just go back in time and to be in a place where their loved one could have gotten the vaccine. We have the opportunity to do that right now. We have the opportunity to protect our family and our friends. And that's why it's so important for us to do this, because COVID's not going away anytime soon. It's not just going to disappear on its own. We've got to protect ourselves against it. And if we do that, what we can turn COVID into is just any other respiratory virus that we can ultimately live with, that won't claim nearly as many lives, and that will allow us to go on with our life the way we were before the pandemic began.
Now, there is some fear in the immigrant community within the Latinx population around registering for the vaccine, and will it hurt their immigration status? Will it hurt their immigration process as they work towards becoming green card holders or citizens or whatever process or pathway they're on? So can you clarify for us what registering for a vaccine actually means? Does the government get access to your information?
Well, I'll tell you, as an immigrant myself, I'm coming from a family of immigrants. I remember that process very clearly, of not only just coming to this country, but going through the process of becoming a permanent resident and becoming a citizen. And it's a really important process. And I want people to know very clearly that the administration has made it crystal clear that getting services related to COVID, whether it's treatment, whether it's a vaccine, will not affect your immigration status. And if you go to an institution to get your vaccine and they ask you for ID, a lot of times they ask you for ID to verify your insurance status, but the rules are that even if you can't produce ID, you should still get the vaccine. The other important piece here is around cost, which is that nobody should be charging you to get your vaccine. And if they do charge you, if you find that these rules are not being followed, you can report it actually to 1-800-HHS-TIPS, TIPS. So it's really important to us that there not be barriers to people getting vaccinated, financial barriers, legal barriers, or information barriers. Because again, COVID doesn't care about your immigration status, the color of your skin, how old you are, how much money you have. We're all at risk, and that's why we all have to get vaccinated and protected.
100%. And so on that same note, there have been reports that potentially we need a third shot to stay protected, right? Or maybe this needs to become a yearly shot like the flu shot. So what do we currently know about whether or not we will need an additional shot or shots?
Well, it's a really good question. And I think time will tell. We don't 100% know yet at this point, like when a next shot will be needed. Because what it depends on is the following: how long our protection lasts from the vaccine. The good news is we have now real world data that tells us that with the mRNA vaccines, the Pfizer and Moderna vaccines that have been used for the vast majority of people in the United States, that protection lasts for at least 6 months and likely for longer than that. So we may be in a situation like the flu, where we have to take an annual shot and make sure that that gives us lasting protection. That shot may be updated, to take into account the development of new variants or mutations that may evolve over time. So the time will tell. And the important part is that getting the vaccine affords you many months of protection. And we've already seen actually from other countries, specifically from Israel, that when you get a large number of people vaccinated, you will see rates of infection plummet. In populations where we've done that, like we think about nursing home residents, where we have a large portion of nursing home residents who are now vaccinated, we've seen a significant drop in deaths and infections in that population. And that's what can happen for the whole country, as we move this campaign forward.
Lastly, I want to really tackle this this feeling of like, I don't know if I'm going to get the shot. I'm a little scared. Let me wait to see what other people, if they grow a third eye or whatever it is. So let's talk about people who are hesitant about this shot. Maybe it's not that they doubt science or that they doubt the benefits of the vaccine, but there is a lot of disinformation and a ton of misinformation out there. So sometimes it's hard to make sense of it all. It's like, what do I do? Do I get it? Do I not get it? Do I wait? I'm young, like it's not going to affect me. So what are your thoughts on how we can actually help our friends and family overcome their hesitancy about getting the vaccine and push them towards getting it so that, we can be closer to what our new normal can be? Because I think we can all agree that we're not going to go back to what it used to be like pre-pandemic.
Yeah, it's such a good question. It's the right question for all of us to be thinking about. How do we address hesitancy when it comes up, among our family and friends? And the first thing is just to realize is that, look, everyone's got to make their own decisions here, right? We've got to respect people's choices, but we also want to make sure that people are equipped and with the right information, that they have the facts, because there's way too much misinformation floating around. And so here's some things that I find it useful to do. First of all, listen to people first, understand what their concerns are, and respect their point of view. Second, ask how you can be helpful. For some people, their concern is they're worried about side effects. For other people, it might be that they think the vaccines work well, but they don't think that they're at risk, so they don't feel motivated to get the vaccine. Others might be worried, about how easy or hard it might be to actually get an appointment. So understand first what people's concerns are and ask how you can help. But on the information side, there are a few key tidbits I think that are essential for people to know. One is these vaccines, particularly these mRNA vaccines that are predominantly used in the United States, the Pfizer and Moderna vaccines, these were not developed overnight. Even though you've heard that they were developed in a short period of time, the technology that they're based on, the mRNA platforms, have been in development for more than 2 decades. So this is not new technology. Second thing to know is that these were rigorously tested in clinical trials. No corners were cut. And these were evaluated not only by government scientists, by independent scientists to ensure that the integrity of the data around safety and effectiveness was strong. Third thing to remember is that around 90% or more of doctors, when offered the vaccine, actually took it. That tells you something about their trust in it. And finally, just remember, again, what the alternative is. If we want to save lives, the quickest path to doing that is to get vaccinated. That's what has been borne out in data from other countries. It's what we're seeing here in the United States alone. That's our fastest path to getting back to normal. And that'll help our economy, that will help our kids learn in schools, and that will help us just enjoy the love and the warmth and the companionship of our family and friends, which is what I know all of us are yearning for. It's what we miss.
And to honor the lives of everybody who's unfortunately we've lost. It's been an unfortunate year, but through it all, getting the COVID vaccine will bring us closer together to be back, right, and to build community once more. Dr. Murthy, thank you so much for joining us today and having this conversation with us and making sure that we close the gap, not just in the Latinx community, but in the US, and that we all get our COVID vaccine. Thank you.
Absolutely. Well, it was so nice to be with you. I hope all of you stay safe, that you stay healthy, that you get the facts and get vaccinated as quickly as you can, and then help your family and friends do the same. If we do this together, we can turn this pandemic around and we can come out stronger than even before COVID began. So thank you for everything you're doing.